Asthma is something that we can do so much more for. It's a condition that there's a lot of options. I think that the first step is to recognize that asthma is simply a pattern of coughing and wheezing, which is a really general term. Understanding what drives it can be very helpful, and then understanding how often it happens. So if you have asthma that's triggered from exercise or cold air, or only exercise in the cold air, or really just something that's intermittent in general, not happening all the time, but very just occasionally, then there's some great inhalers we can use. Or you can also have variants of asthma that are secondary to acid reflux, or you can have some that are secondary to nasal polyps or aspirin sensitivity. So really pinning down what other driving factors are there can be really helpful at us thinking about things. And that helps us choose our treatments. We can look at lab work to help define different biologics. There's several biologics for asthma now, so that we have medicines that can target certain parts of the immune system to calm down inflammation in strategic ways and to help you breathe a lot better. And then, of course, as we mentioned earlier, even a course of allergy injections. I typically would put a course of allergy injections ahead of biologics. You're using a treatment methodology that's been around 100 years rather than having a patient sort of chronically need to be on medication like a biologic.
Yeah. That's great.